Hello guys, my name is Tanvir and today I'll be presenting on Alzheimer's disease. So here are the topics that I will be going over for today's presentation. And here's our first slide, Introduction to Alzheimer's disease and its symptoms. So, Alzheimer's disease is often referred to as AD, and it is a progressive and debilitating neurodegenerative disorder. It primarily affects older adults and is most common cause of dementia, and it's accounting for 60 to 80% of cases. This disease leads to significant cognitive decline and memory loss, making daily activities increasingly challenging for those who are affected. The impact of Alzheimer's disease extends beyond the individual and their families and caregivers, creating a substantial and emotional and financial burden as well. Understanding this is very crucial as there we can develop effective care strategies and support systems. Research in this area is also very vital as it helps us unravel the complexities of the disease, paving the way for better treatment and prevention methods. So today, the goal is to gain a deeper understanding of this condition and its far-reaching implications. So the signs and symptoms. Alzheimer's disease presents a range of signs and symptoms that progressively worsens over time. In the early stages, individuals may experience subtle memory lapses, such as forgetting recent events or conversations. This can often this can often be mistaken for normal aging, and as the disease advances, these memory issues become more pronounced, leading to confusion and disorientation. For example, a person might get lost in familiar places or struggle to recognize loved ones. Additionally, Alzheimer's affects language skills, making it difficult for individuals to find the right words or follow conversations. This can lead to impaired judgment, where decision making and problem solving abilities decline. Behavioral changes are also very common, with individuals experiencing mood swings, depression, and anxiety. These symptoms severely impact the quality of the life and for those who are affected, and it is important to find early detection and intervention. And by recognizing these signs early, you can provide a better support and care for those individuals. So, our second slide is about the risk factors that are involved. So, as you can see, AD has several established risk factors that contribute to the development. Age is the most significant non-modifiable risk factor, with the likelihood of developing AD doubling every 5 years after the age of 5, according to the Alzheimer's Association. As the population ages, the number of individuals affected by AD is expected to rise significantly. Oops, sorry about that. Genetics also play a huge role as well, particularly mutations in the ATP, PSNE1, and PSEN2 genes, which are associated with the early onsets of AD. Additionally, the presence of APOE A4 allele increases the risk of late onsets of AD. Lifestyle factors including cardiovascular health, diet, physical activity are also significant, and conditions like hypertension, diabetes, and obesity can elevate the risk of developing AD. And engaging in regular exercise, maintaining a healthy diet, and staying mentally active can reduce the risk or delay the onset of AD. Environmental factors such as exposure to certain chemicals and a person's medical history, including a family's history of certain illnesses, can also increase the risk of developing AD. And there has been a gender difference between the two. Some studies suggest a higher prevalence in women, actually. AD tends to affect specific populations more than others. Age is the most significant factor, as I mentioned previously, and it primarily affects older adults. Gender also plays a role as well, and how I mentioned before, women are slightly higher risk than men, and this difference is usually due to women living longer than men, thus having more extended exposure and age-related risks. Okay, so let me see. The next is ethnicity and race. They also influence AD. Studies have shown that certain racial and ethnic groups, such as African Americans and Hispanics, have higher rates of AD compared to Caucasians. These differences could be attributed to varying genetic factors, health conditions, and lifestyle factors that are prevalent in these communities as well. Socioeconomic status is also another impact as well, such as less access to healthcare, nutritious food, and opportunities for physical activities and cognitive activities. And one of the primary pathological hallmarks of AD is the accumulation of amyloid beta plaques. These sticky clumps form between neurons to disrupt cell-to-cell communication. Along plaques, neurofibrillary tangles composed of twisted tan proteins accumulate inside neurons, leading to the cell death. The hippocampus is also crucial for memory formation, and the cortex is responsible for higher cognitive functions are significantly impacted. As these neurons die and the connections are lost, brain atrophy occurs, especially in these critical areas. This widespread damage results in cognitive decline and memory loss results in cognitive decline and memory loss, which are characteristics of AD. And going on to our third slide is diagnostic tools and tests. So diagnosing AD involves multiple steps to accurately identify the condition and determine the appropriate treatment plan. First, you want to start off with the symptoms, which include memory loss, confusion, disorientation, difficulty with languages, impaired judgment, and behavioral changes. Next, you want to perform several tests such as MRIs, PET scans, and mini mental state examinations, and Montreal cognitive assessment. These are all done to evaluate memory and thinking skills, to get detailed images of your brain to see if there's any atrophy, or PET scans are also used to detect like any amyloid plaques as well. Alright, so based on the results of the tests, you can confirm whether or not AD can be ruled out, and if it is confirmed, the treatment plan typically includes medications to manage symptoms and lifestyle changes, cognitive therapies, and support groups. So as you see in the flowchart here, it illustrates a comprehensive approach taken to treat AD actually. It ensures that each patient receives tailored care based on their specific needs as well. So the fourth slide, prevention and control. Preventing AD involves adopting a holistic approach to health and focusing on both lifestyles. Managing risk factors is also another thing as well. One of the most effective strategies is maintaining a healthy diet, rich in fruits, vegetables, whole grains, and lean proteins. And studies have shown that diets such as the Mediterranean diet, which heavily emphasizes these food groups, can help reduce the risk of cognitive decline. Regular physical activity, at least 150 minutes a week of cycling, walking, swimming, aerobic activities are shown to improve blood flow to the brain and your cardiovascular health. Cognitive engagement, such as doing puzzles, solving puzzles, learning new skills, social interactions, and managing your cardiovascular risk factors, which kind of ties into the physical activity, significantly helps prevent AD. So the next thing to focus on is regular health checkups. Going to your physical, going to your annual exams, doing routinely checkups, getting your blood work done is also a crucial aspect of preventing and monitoring AD. So our penultimate slide, societal and lifestyle impact. So AD has a profound impact not on only individuals but also their families and society as a whole. One of the most significant aspects of this is the emotional burden on families. Caring for loved ones with AD can be incredibly challenging and stressful, often leading to feelings of helplessness, sadness, and burnout. Families have to navigate the progressive decline in their loved ones' cognitive and physical abilities, which can be heartbreaking. Additionally, the emotional toll AD also imposes a substantial financial burden on the families. The costs associated with caregiving, medical treatments, long-term care can be overwhelming and can put you in lots of debt. Many families often deplete their savings or go in debt to cover these expenses. And according to the AD Association, the cost of care for AD in patients in the United States is projected to reach $1.1 trillion by 2050. So this highlights the significant financial strain that is often imposed. And the healthcare system faces considerable challenges as well in managing the growing number of AD cases. Providers must deliver comprehensive care to address the complex needs of the AD patients, and the increasing prevalence of the disease places additional stress on the healthcare facilities as well, and the professionals who are already stretched thin. And our last slide, the conclusion. In conclusion, AD is very complex and devastating to the families, and it is a devastating condition that affects millions of individuals and their families worldwide. So far in this lecture and PowerPoint, we've explored the critical aspects of AD, including its signs, symptoms, risk factors, effects on the brain, diagnostic tools, prevention strategies, and its profound societal and lifestyle impacts. Understanding these facets is essential not only for developing effective care strategies, but also fostering a supportive environment for those who are affected. The emotional and financial burdens on families, coupled with the challenges faced by our healthcare system, underscores the need for the comprehensive and compassionate approaches to care and support. And ongoing research is also vital as well, as by supporting the scientific endeavors and promoting awareness, we can move closer to finding a better treatment and ultimately a cure in the future. So I encourage everybody to contribute to this cause, whether it's volunteering or supporting the research initiatives or spreading awareness, okay? And thank you for listening to this PowerPoint and this presentation. If you have any questions, please let me know in the discussion board, alright? Thank you guys.